Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CEUs. Today's webinar is Clinical Success for Treating Diabetes in Relation with Coronary Heart Disease with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience from treating over 500,000 patients and specializes in differential diagnosis and herbal prescription. We are excited to have you here with us today. Before we get started with the webinar, let me familiarize you with our webinar room. Please set your chat from hosts and panelists to everyone. That way everyone can be a part of the conversation. To ask Dr. Chang any questions, please use the Q&A box to ensure the questions remain separate from the chat room. And as a quick reminder, the quiz for the CEUs will be available for the next business day, late afternoon, for everyone with qualifying attendance. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he strictly purchases herbs directly from them. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal ABX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed as Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the formula. Dr. Chang typically prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in traditional Chinese medicine, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Synergy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. All right, now let's get started with today's webinar and welcome Dr. Jimmy Chang.
You do a test.
Testing. Can you hear me now? Oh. Okay, I'm on.
Yeah.
Hi guys, it's me again. Today we're going to talk about a very interesting subject they call the diabetes in relation with coronary heart disease. This is very interesting. We call it the sweetheart syndrome. I discovered the relationship between the diabetes and the heart problem is about 25 years ago when I just first got the USA. I didn't know there was a connection between these two problems. And suddenly one day from a big guy, I found out that, oh my God, he is diabetic, no doubt about it, and with with a big stomach fire. And then that big guy has a pulse within the pulse on the left spoon. And we will explain it to you later for the newcomers. And suddenly I connected them. There's two things. They have all the symptoms, all the problem with the heart, with the mitral valve regurgitation, with the infraction, with the injury, and a very high sugar, along with edema, with high cholesterol, a dark face, swelling legs, and everything. And fatigue is definitely in there. But the problem is those things can be fatal. It's dangerous. It's not just a related disease, not just a discomfort. It's life-threatening. So then afterwards, I study and combine them all together as sweetheart syndromes. And at the final stage of today's seminar, I have a very simple solution for all this terrible, overwhelming, life-threatening condition. Okay, so stay with us. And now what I do? Change page?
Okay, next page. 一个跟我讲 change page 就变 change page。
Oh, how can one enhance medical skills and earn greater trust for patients during consultation? Yeah, we need support from the patient. We need confidence. We need trust from the patients. Then you can have a better business. Let's say business, okay, for the better future. How do we do that? We'll be talking about that at the end of today's seminar. So stay tuned. Out. Okay. Okay, mouse.
Yeah.
Oh, this is the normal heart. There's a heart failure. See the
It comes
chamber.
Can
Huh?
you see the mouse? Can you see his mouse
Oh, you
in
mean
the recording?
a little bit
那个很小 you have to use the pointer.
on the annotator.
What pointer?
Use that. You know, like the zoom. You take out this thing.
Oh,
它有一个那个 marker，就大一点。
the pen.
The pen. Oh, use it. You can see?
No, I use the drawing tools.
You got it.
Yeah, okay, better.
Okay, this is the normal heart. See, the chamber is pretty normal, and this one's absolutely enlarged. Enlarged chamber is the final stage of the heart, because in the beginning, the heart will somehow enhance create more thick wall, like more muscle. Like you go to the gym, you build up heavy lifting weight, and you get a big muscle. But after because the heart has more resistance to fight with, they have to work harder to put blood through the entire body, especially for those overweight body. So the burden of the heart, work of the heart becomes heavier and heavier. And if you do not do anything about it, I mean, you do not do anything about your own body, you still eat like crazy, you still eat those greasy burgers and stuff. And finally, the last stage, the heart had no choice but to become bigger, to push the more blood out of the ventricular chamber. And finally, it gave up. Then it's the final stage. So in this pause, in this condition, the pause will be my gu pause. If you still remember my pause diagnosis, whenever there's a gu pause, then that means the heart is fighting, struggling. That's very dangerous, huh? Okay, 下一页. Now, diabetes, it affects the large vessel, not the small arteries, not capillary artery, not like the kidney problem we talked about before. That affected the small vessel. In this condition, it's the large vessel that matters. So the large vessels in the heart area is so tired after if you don't treat it properly. You keep on eating all those greasy food with the hereditary condition from your family, and you have no exercise, no control of your eating, then this will be a problem at the end. Complication of diabetes. Now that I found out this 25 years ago. Usually I don't pay much attention to them, but nowadays I start to focus on this condition more and more. It mainly caused by long-term, high blood sugar. So how do a person get a blood sugar, and how it become long-term? This is the key word, long-term, not 2 days, 3 days. How? Because you don't treat your body fairly. You eat and drink and no exercise for a long time, and always complaining, I'm so fatigued, I'm so tired, to your doctors. And this long-term thing give you sugar that cause damage, the cardiovascular disease, heart disease, and stroke. If your blood pressure cannot be lowered even by Western medicine, then the stroke could be on the way. So we call it sweetheart syndrome. Sounds good, but it's deadly, huh?
Sweetheart too is deadly.
Huh?
Sweetheart is also deadly.
Yeah,
Some
sweetheart,
sweethearts.
become with a sweetheart. Symptoms of microvascular and neurological disease, blindness to the renal failure, retinopathy, cataract, glaucoma. Cataract is not treatable and actually doesn't need any treatment. One day operation will do it. But glaucoma, sometimes the Western medicine cannot treat it properly. We can do it with Chinese medicine. Vascularization around the foot and the neurological lesions. This one can be dangerous, huh? This can lead to amputation due to infection, ulcer, and gangrene. Like I said, I mentioned in the previous seminar that some of my friends, they didn't have an amputation, but they have the infection, ulcer, and gangrene on the foot and caused their lives from cancer. They are being treated by cancer treatment, chemo, whatever, but they die from this, from the infection of the foot and the toes, not from cancer. I know more than one case, no amputation, but to the infection of the toes and the leg, and they got killed by those gangrenes, by the infection. That's too bad, huh? Yeah, we have something to do with that. Sorry, we can do something about that, huh?
Yeah, you don't have anything to do.
Come on, next one. Okay, what are the top complications of diabetes? Stroke. This is avoidable. Kidney failure, we talked about on the previous seminars and very thoroughly. If you do not still you don't understand it, or you didn't attend that seminar, you can call Tina and buy it from them. Foot problems, huh? That's definitely dangerous. And cataract, I know that. This from all those are from peripheral circulations blocked. Heart disease. Okay, today we'll be focusing on this. There's a lot of things to be done, and sometimes it's very good if you treat it properly. It can be reversed by Chinese medicine and some other means. At the end of the seminar, I will let you know what to do with all those problems, because I'll be talking about all those things in the following pages, and you will see, oh my God, so overwhelming, so many complicated. What are we supposed to do? Should we lower the blood pressure? Should we treat the kidney? Should we treat the circulation? We treat the eyes, or treat the heart, or treat the vascular disease? How many herbs do we need to provide them with that, to deal with all those problems? Huh? We have a simple way, don't worry, huh? Okay. 下一页. Oh.
Oh, see? Oh, yeah.
Okay. So we go directly to the high blood pressure and heart pulses. For blood pressure, usually we have two kind of pulses. First is the weak and weak. No jumping, no rebound pulses, weak pulse. And secondly is the things we're talking about, the heart. What do you mean heart? When you check the pulse you feel like a rubber tube. I'm sorry. Yeah, soft rubber tube, like a straw or something. Not very hard. But for the guy with arteriosclerosis, their pulse can be very hard. How hard? Just like a rubber tube. No rebound, very hard, difficult to press, difficult to stop it. And the blood pressure can be sky high. With a heart pulse, this is not kidney type. It's just arteriosclerosis. How do we find a heart pulse? If you try harder in your clinic every day, I'm sure you will encounter a lot of people with high blood pressure. I always have my patients had their blood pressure taken before entering my room. I think I suggest you should do that. And once you find out, once you feel it, you never forget. Oh, this guy, oh, the blood pressure 178 over 110. Oh my God, so high. Then feel the pulse. Then it's not kidney type, you can directly tell it's the hardening of the vessels. And from how do a person get a hardening vessel? We'll see later. This is the typical combination. Dilong is the earthworm. Dansen is for heart, for the circulation in the chest. And Xuansen is the black shen and taste the salty. So that's the function to destroy all the blockages, either in the kidney or in the blood vessels. 下枯草 is for the eyes and for the head, to clear the head, to clear the blockage in the head. 茜草 seems to be a medicine for period. If the ladies or the girls' period hasn't come for several months or something, you can use 茜草 to make it come. So like a blood mover. And actually, I would like to add one more thing. 你打还是我打？
我打
槐花有没有槐角？没有。
槐角没有，
OK
槐花米是不是？
啊，
槐花米是槐花。它这个是几趴 ？How many percent？
1, 2, 3, 4, 5, 6 of them. So 7.
17% each.
Yeah. Something like that. My math isn't so good, so it's about 100.
Is that 100?
I like this 槐花 very much. So 槐花is for clearing the expanding blood vessels, especially when the head is swollen up. Usually when I see the patient, I'll always look at their fingertips. It's the nail. If their fingertips are swollen at the end, you will see, and sometimes you see the back of the fingertips. If it's red or something, then I would directly tell them, hey, you have something in your head, swollen up. And if the blood pressure is high, that means all the fire goes up to the top. And then that's a dangerous situation, might get a stroke or something. So if before you take the pulse, you should check the guy's fingertips with the fingernail or the back of the fingernail, finger. If this area is red and swollen, then this is the head. This is the resemblance of the head. So you can directly tell something not so healthy in the guy's head. And if the blood pressure is really high, that could be dangerous. Well, the patient might say, I'm taking blood pressure medicine. So still high, still dangerous. So in this case, we use 槐花. Huai Hua can clear the swollen vessels, small vessels in the head and also in the anal area. So that's, I use Huai Hua to treat hemorrhoid. Hemorrhoid is the vessel, the veins swollen up, just exactly like the things swollen in the head. So I treat it with the same thing. So you can put them all together, they will drop the blood pressure real fast. And most interesting is the Xuansen. I like this one, very good. In Chinese medicine, says salty herbs can destroy the hardening tissues or something. So the Xuansen I use for kidney type blood pressure and any kind of hardening vessels, including headaches, swelling eyes, swelling anus, anything swelling with a fire, I use Xuansen, including the tonsil, the chest, or in the veins, even the veins, varicose veins, even for the people, a young guy with a varicose seal, the swelling tubes in the testicle or abdomen area, if you want to have children, I use the Xuansen to cool it down. So the temperature drops and the sperm count will be better. So Xuansen is a black shen. That's very interesting. for cooling the fire. The black killed the red, right?